Initially, we had for a long time already been doing part of the treatment summary in the fact that we were already giving patients information about what things to look out for that might indicate a recurrence. And the other reason was our consultants at Airedale do not routinely give out copy letters to our patients, so patients didn't have anything written in black and white as to their treatment summary, their diagnosis, and what the treatments that they'd had, and we felt therefore that it was a need that the patients were lacking. The difference that it's made for patients is that all the treatment that they've had is all on one document, and the feedback that we've got from our patients is that it's really useful not only to give to other people within the multidisciplinary team. So for example, if they're visiting the district nurse or the district nurse is visiting them, they can actually give this piece of paper to the district nurses, which explains everything that they've had treatment wise, and they don't have to keep repeating themselves to various people. And also we've found as well, our patients have found it really useful for relatives and friends, because for some patients it's really upsetting what they've gone through, and they can actually just give the piece of paper to the relatives or the friends just to explain exactly what they've had done. Making the summary accessible to everybody, and I'm meaning from an IT point of view, and working on the documents, making sure that the documents worked on system 1 as well as working on our PPM system as well, because we had to use different documents for each system, which was really difficult, but with involvement with our IT people and the people that do work on system 1, we got there in the end, but it was quite difficult. Don't wait for the time to be right. It's never going to be right. You're never going to have time to do it, so you've just got to get on and do it. I would say start small. So we started with a small cohort of patients, just the patients that had one mode of treatment, the surgical patients, and then grew it from there. And I think the other thing is to stay really positive. You are going to have setbacks, things are going to go wrong, you're going to have to change things, and that is all part and parcel of it. And the final thing I think is look at what you can do rather than what you can't do.